First, the man who became the face of Australia's vaccine rollout. Dr Nick Coatsworth was front and centre in the government's TV campaign, urging people to get vaccinated. But critics say his message has not cut through. I spoke with him a short time ago. Dr Coatsworth, thanks so much for joining us. 1 month into this lockdown in New South Wales, and the numbers, they're not getting any better. COVID cases are stubbornly high, and sadly we've seen more deaths. Why aren't these tough restrictions working?
I think we saw this in the Victorian second wave of last year, that when COVID gets into certain communities in Australia, the communities that are sort of the engine rooms, the factories of our big cities, it can be extraordinarily difficult to flatten that curve again. What we have to be thankful for, of course, is that the efforts of Sydney-siders have stopped the numbers of COVID-19 cases going up exponentially, doubling, tripling, and so certainly the restrictions are having some effect, but it's just not as quick as we might like at this point.
And the list of exposure sites, it's long, it's growing longer, and it's where people are going to get the essentials. It's supermarkets and it's pharmacies. How do you stop the spread in these locations? Because you can't stop people from going to get food and medicine.
I think the reminder has to be, look, meticulous adherence to those things that we were doing so well last year. Hand hygiene, mask wearing, social distancing. Of course, you have to get your essentials. But the big weapon that we didn't have last year, of course, which we have now, is an effective vaccine. And whilst we talk about the vaccine stopping severe hospitalisation and death as the most important reason to get vaccinated, it does actually reduce the transmission rate as well. Doesn't eliminate it, but it does reduce it, which is why getting as many people vaccinated in southwest Sydney is going to be an important part of this battle.
So how much longer will Sydney be in lockdown? Is September, October, even Christmas? Is that what we're looking at here?
Well, look, I think it's really important just to go back to the principle of going day by day, if only for the mental health of Sydney-siders. Remember last year when there was sort of these speculations in Melbourne, and it doesn't help the people going through this, and it's just as likely that we may see a plateau or a decrease, or the numbers might go up. They were bouncing around for several weeks in Victoria before we saw a clear trend. So I think rather than speculating, let's just concentrate on doing the right thing in Sydney, and those numbers will come down.
There's not much hope though, and we've had 4 deaths in the past 2 days, including a woman in her 30s with no underlying health issues. 10 deaths in this current cluster so far. It's far from just a flu, isn't it?
It's far from just a flu, and I think that's a really important message for the Australian community. COVID-19 is not influenza. However, once you get vaccinated, it becomes a lot less of a risk to yourself and your family. So that's the overwhelming message, is to get out and get that vaccine into your arm if you haven't had it.
And do you expect that we will see more cases after the disgraceful anti-lockdown protests that we saw on Saturday?
It's certainly a risk, and that's why you know, those protesters came from a variety of different backgrounds for a variety of different reasons, but they all need to realise that this Delta variant is very transmissible, and even if you're outdoors, if you're in close quarters like that, then it certainly is a risk. So look, it's entirely possible that we'll see cases out of that, and that would be as tragic for those people who were there to get COVID-19 when they could have avoided it so easily by not protesting.
Yeah, it's appalling, calling for freedom and potentially making the freedoms we all want extend for even longer. Now, you've been the face of the vaccination rollout, the campaign to get the jabs in arms. Has that campaign been effective?
Well, I think we're at 11.1 million or so vaccines in arms. You know, certainly as I walk around the street, it's clear that there's a lot of facial recognition there, but that doesn't necessarily translate into people getting the vaccine. We've still got a lot of work to do to convince some Australians, some of my patients included, who have been waiting, wanting more advice, wanting more information. And whilst that hunger for information is there, then it's up to people like me and others in the media to provide it in a clear way and convince people that vaccination is really the only way back to any sort of normal.
But that hope hasn't been realised. You must have been expecting a higher percentage of the population to be fully vaccinated by now. 16%, we're very far behind.
Well, actually, what I'm very happy with is just seeing those numbers around 175, 180,000. They're getting bigger every weekday. So we're not seeing any plateauing in the desire of Australians
But
to
we're
get
not seeing it
vaccinated.
increase exponentially either.
Well, I think that is likely to change. I'm not going to make too many predictions, but that one I think we can be relatively assured of as the supply of Pfizer starts to increase, and also the messaging around AstraZeneca becomes even clearer with the change in ATAGI advice today, recommending anyone in the Sydney Basin over the age of 18 to consider getting the AstraZeneca vaccine.
Yeah, and I spoke to the Pharmacy Guild today. Pharmacies have started delivering vaccine doses, and the message that they had was very simple. If you're over 18, get the vaccine. Do we need to make it much simpler for people to understand and have confidence in the vaccine, and also then make it simpler for them to get the jab?
Well, I think that's a really important message you heard from the Pharmacy Guild today, and indeed the vaccine, the AstraZeneca vaccine, has always been licensed as a safe vaccine for people over the age of 18. It's simply that ATAGI put in age recommendations, which they always said that they would revisit in the event of an outbreak, and here we are, and they've been revisited. So anyone over the age of 18 in Australia who hasn't been vaccinated against COVID-19 should consider getting whatever vaccine is available to them immediately.
And have those confusion, the messaging that's changed, the rules that's changed, has that muddied the waters?
I don't think anyone would contend that it hadn't. I mean, there were clearly reasons why it happened. The European regulators had put in age recommendations. Even the United Kingdom had an age recommendation for the AstraZeneca vaccine. So no point at this stage, I think, in looking backwards, but there's every point in looking forwards and discussing AstraZeneca and Pfizer with our community and convincing them that now's really the time to get vaccinated.
And you've got the Prime Minister on one hand telling us that the vaccine isn't the way out, that it's lockdowns, but you've got the New South Wales Premier saying it's all down to jabs in arms. How damaging is the politics surrounding this pandemic?
I think we can reconcile those two views quite easily. The most immediate effect that you're going to have on those numbers is through movement restrictions. But certainly, if you get a first jab into someone's arm today of either vaccine, within 21 days, you're going to start getting some degree of protection. And once you get the second jab of either AstraZeneca or Pfizer, you'll get full protection from severe hospitalisation and death from the Delta virus, so the Delta variant. So, you know, both those things are true. And whilst we restrict, at the same time, we have to get as many people vaccinated as possible, as quick as possible.
And should we see other states providing extra doses of Pfizer, because New South Wales is crying out for help with the vaccines?
Look, each state has its own individual public policy position. I think it would be a wonderful symbol for Australians to see states donating part of their Pfizer campaign, Pfizer supply to the New South Wales vaccination campaign. Of course I do. I think that would be a wonderful symbol. Whether we will see any of that, I'm not sure. We'll just have to see what happens over the coming days.
And we are meant to be all in this together. Dr. Nick Coatsworth, thanks for your time.
Thank you.